Okay, welcome to Small Talk. And in this podcast, we'll be discussing issues related to teeth and most common questions that we receive from our patients. And me and Jessica will be discussing about it. Today's topic is basically about misaligned teeth. Um, this topic is not very commonly discussed, and a lot of people ignore this. And misaligned teeth are just more than cosmetic issues. What do you think, Jessica?
Yeah, I think a lot of people are more concerned about their looks, but they don't realize that it's actually related to their health too.
True. Yeah, and that's exactly the truth. And let's talk about what are misaligned teeth. Okay, so misaligned teeth are basically when your upper and lower teeth are not matching with each other. Okay, this could be crowding, spacing, overbite, underbite, cross bites. These are all different names of malocclusions, and uh, although these might look like a minor process, but like a minor thing, but it has more than that.
Yeah, it affects your breathing and it affects your chewing, your cleaning, your the way your teeth clench, how you speak, everything, your chewing. It's crazy how it just affects everything.
Correct. Yeah, and I mean, there are more. It's just more than, as Jessica said, it's just more than cosmetic issues. Most of the patients that come to us as an orthodontist, they are coming here for cosmetic issues. But when we educate them, then they find out that exactly what issues are going on. And it's not. It causes decay. It causes tooth fracture. TMJ problems, headaches. It's a very common thing. And another thing that I feel like when the patients open their mouth, then what happens, if they have crowded teeth?
Yeah, well, it affects their digestion too. I
Not
mean,
true.
you
Yeah.
you brought that
Hmm.
up earlier, so
Yeah. And sometimes it's the bad breath that,
yes.
we as dentists,
Oh yeah.
we sometimes have to face that thing,
Yes,
and
yes.
we see this on a regular basis. So, but I mean, as I said, it's these are more than just cosmetics. More important, I cannot emphasize enough on this thing that it is a health issue. So if someone in your family or yourself, you see some crowding or malocclusion, okay, definitely discuss this with your dentist, and see an orthodontist, or seek what can be done. Um,
And don't forget, like even if you have great hygiene, you brush, you floss, everything, your breath could still smell really bad just because your teeth are overlapping. Just because you have a great routine doesn't necessarily mean that your hygiene is real up to par.
Yeah, and I mean, now the medical research has shown us that the food that's trapped between our teeth, and the infection that we have because of that, it affects our general health. It causes increased chances of strokes, heart problems, kidney issues, low birth weight. All these things can be related to your oral hygiene. Okay, and definitely those hard to clean areas. That's where the most of the plaque gets stuck. Um, so let's talk about that. How the food trapped in our teeth turns into a health risk. So what basically happens is that when we have the food trapped between our those crowded areas, okay, and the bacteria grow, and it causes inflammation, which we call gingivitis or periodontitis, and it releases those certain chemicals that actually affects your blood vessels and heart and brain and all these things. So that's why, although nobody thinks about it, but this is proven by medical research now that these things are there. And then, of course, I know as a dental assistant, you have to smell that bad breath, So, yeah,
it does, and I feel bad for the patient because they not necessarily they know their breath smells like they're embarrassed, and you see people do this a lot, and in pictures too, that they're embarrassed. I have a friend that has periodontal disease, and she would do this a lot, and she had to have all her teeth removed and get dentures because she was embarrassed, and she has a beautiful smile now, but it can be prevented, and there's a way. Go see your dentist, go see your orthodontist, get your teeth fixed.
And how old was your friend?
Oh, she was young. It started when she was like 19.
Oh wow. You see, I mean, so it can happen. We always think it's only for older people, but no, at a
No.
very young age. And imagine a 19-year-old needing all their teeth getting extracted.
Yeah.
That's sad.
And it
you know.
doesn't help because she smoked too. So
Oh.
smoking, I think it kind
Yeah.
of pushed it further too.
Yeah, I mean, and as an orthodontist, and you're right, a lot of time these patients may not even know that their mouth stinks,
Yeah.
because they are doing everything in their mind. They're using mouthwash, they're flossing their teeth, they're brushing their teeth. Their teeth look great, but because those hard to clean areas, because of that crowding, it causes that bad breath, and now of course that affects your socialization. I mean, well, it affects you in so many different ways.
It sure does.
Yeah. Definitely there is an emotional side to it too, and I can share so many stories. Interestingly, recently, especially after COVID, what we noticed is there is a very increase in number of adult males that start getting orthodontic treatment.
Yeah.
And when we asked them that what is the main reason for that, they said, I'm on my Zoom meeting all day.
Yeah.
And now I can see that my teeth are so crooked.
Yeah.
So I'm getting that fixed now. And they were embarrassed to go on those Zoom meetings because they don't want to show their teeth. And that's the only thing that you're seeing on these virtual meetings. That's the face, and of course, if they open their mouth, they can see your teeth. So then that's when they start coming in for getting the teeth straightened. So share with me, what's something that you think, what's the first thing patient tells you after their teeth are straight, and how do they feel?
I think they don't stop smiling, first of all. And then I hear they're so big and slimy. And then we get past that situation. And then they smile some more. And then they are so happy. They thank us like over and over again. I love you so much. Thank you so much. You've done such an amazing job. And of course, I can't stop smiling. That's why I got into this, was just because I can make someone happy. It makes me feel good. I didn't know what I wanted to do for the longest time, but I had braces as a kid because my teeth were sideways, and that made me feel good. And I was like, this is a good position. Like, I love it.
Of course, I have treated so many patients, and one of my favorite stories is that I treated a 44-year-old female, and she, once I was done with her treatment, we did clear aligners treatment on her, and when I was done with her treatment, she came back to me after a few months, and she hugged us and brought so many goodies to us, and she said this was my first Christmas that I actually had the smiling pictures. Aww. In 44 years.
That's so sweet.
Yeah, so it's definitely, you make a big change. And imagine those 43 years that she has gone through. She has never smiled. She was never perceived. She shared that with me, that I was never perceived as a friendly person or the pleasant person. I was always someone who would not smile, so people would not. So it was affecting her emotionally too. So
100%.
When she came back and she did this thing, it made all of us very emotional too. Because that we did so much for that. So what are the solutions? Like, now we know that this is a health concern, this is an emotional side of it. What are the solutions these days?
Doctor, you can't see yourself, but you're actually tearing up.
I know. Because whenever I think about that patient, it makes me feel like, because we sometimes don't realize that how much we are doing for the patients and how much it means to them. It would be a routine thing for us, but we are making a difference in someone's life.
It does. It makes you feel good inside. So I'm sorry, say that question again.
So the question is, now, what do you say? What do you tell our listeners, that what should they do now they know that this is a thing?
It's treatable. Just come in and first see your dentist and get cleared, and then see your orthodontist, because it's a treatable condition. It's 100%.
And you don't have to go through braces. Nowadays we have clear aligners. Clear aligners, we can treat easily 60 to 70% of the cases with clear aligners. So definitely there are options. You don't have to go through the braces only. You can seek different options. Okay. And with time, as the things are passing by and new technologies coming in, the cost of treatment is going actually down.
Yeah.
So I know everyone talks about inflation, but on this side, actually, the cost, they are more affordable. There are so many different ways we can seek this treatment, and it's more affordable now. So, any final thoughts?
It's not your grandma's aligners either. They're not the bulky things anymore. So, or the bulky braces anymore. So, I mean, we can make them look good, and we can make them thin, and we can make them small, whatever you need. So we can make them how you want them. So we can customize what you need.
Perfect. Yeah. And my final thoughts are, all my listeners who are here, I just want them, if anything, one thing you can just take it from this podcast is, this is not only a cosmetic issue. It's a health concern. Okay. Your nice, straight, beautiful teeth are a sign of your good health too. You should have your teeth when you're celebrating your 100th birthday. Okay. So, and it's possible. I know everyone smiles about it, everyone laughs about it, but it is possible. My oldest patient, was in treatment. I treated her at the age of 87.
I believe it.
And she has beautiful teeth because she has taken care of her teeth throughout her life. And if you had braces already and your teeth have relapsed, still, please go back and get those aligner treatment done. It's so simple and easy, but get it done. Don't ignore it. Don't make it worse. Okay. Any final thoughts? Any final words, Jessica?
I think we said it all.
Perfect. No, thank you so much. Thank you, Jessica, for your time. It was wonderful talking to all of you. Okay, and thank you, Jessica, for your time also. We'll definitely be coming back with more questions. Send us your questions, and we'll try to address all of them. Thank you.
Thank you.
Bye-bye.